Kampala is the capital city of Uganda. It has a population of about 2 million people. The city is also the host of the highest concentration of people who are most at risk to HIV infection, referred to as key populations. These include border riders, long-distance truck drivers, commercial sex workers, uniformed personnel, men who have sex with men, injecting drug users, fisherfolk, and market vendors. About 40 kilometers from Kampala is Entebbe municipality, Uganda's international gateway. The peninsula is an entertainment hub with numerous beaches and fish landing sites which are hotspots for most at-risk populations. Kampala and Entebbe have high HIV prevalence rates of between 8 and 14%, far above the national average of 7.1%. Unfortunately, Kampala and Entebbe do not have adequate HIV/AIDS interventions specific to the requirements of these urban centers. Urban leaders, through the Alliance of Mayors and Municipal Leaders Against AIDS, Amicaall, requested the support of the Danish Development Agency (DANIDA) to implement targeted interventions to increase uptake of comprehensive HIV/AIDS services for the most at-risk populations as a means of reducing HIV infections under the ADMARPs project.
The Danish embassy was of good help to Amicaall by providing funds to engage in HIV and AIDS activity, particularly targeting the most at-risk persons. And we do implement this project through the structures of Kampala City Authority and, of course, the local government structures in Entebbe municipality.
Political leaders in the urban local governments are playing a significant leadership role in the implementation of the interventions, especially in sensitizing their communities and participating in the various activities with the most at-risk populations.
Where we engage a lot in HIV prevention interventions targeting those key populations, we also go with the whole package of the prevention services like condom awareness and distribution, like safe male circumcision, like HIV counseling and testing, like even family planning and reproductive health services. We provide them in packages. That's one part. The other part is that we adopt an outreach approach where we go to the communities. We don't wait for the communities to come for the services, because by their nature of livelihoods and work, the key populations do not naturally come for services to the established health service point.
Amicaall supported urban councils to train peer educators from among the most at-risk populations to serve as behavior change agents to foster HIV prevention, treatment and care. Paul Kagaba, a border rider in Kayumpe Division in Kampala, who was trained as a peer educator, now regularly interacts with his peers to sensitize them on HIV/AIDS in groups, but more frequently in one-on-one counseling sessions.
Mukukyusa kwabo okwembeera nti bw'afuna akalwadde kati konna kagube musujja kakubere senyiga kakubere kolla bantuukirira bangamba olowooza sinza kuba nga nakubye envundu bagiyita batyo sinza kuba nga nakubye envundu nandibadde ngenda ku muddwaliro olaba otya nimuga kati genda kikawaala mu ddwaliro bakukebere balabe ekyekiriwo.
The peer educators also serve as condom distributors because they are able to explain to their peers how to use the condoms and the importance of using them consistently. Susan is also a peer educator who sensitizes commercial sex workers to test for HIV and avoid risky behavior which exposes them to HIV infection.
Kuba bannanga abamu babadde oba bali addicted kuba nti banywa omwenge ne bagenda ne bakola ki ne bagenda ku mirimu. Kati bwe nafuna training mu Amicaall ne mbagamba ne mbabuulire omwenge ogwo mubi nga nguvumirira ne mbagamba mubi kubanga ne bobeera ku mirimu eyo ng'okola obeera toyina control ku mubiri gwo. Omuntu waddemba okujja n'akutwala ate n'atayambala condom, kati ekyomwenge abamu bagenda baguviirako ddala.
Peer educators regularly meet with Amicaall staff and staff of the urban councils to share their experiences and review the data they gather from the field.
The information we get from the peer educators is used for planning purposes. For example, if you want to know how many people you can provide the services for, usually we use the information gathered by the educators. For example, number of condoms that you are going to dispense. Usually we rely on the statistics, on the data which was collected by the educators.
All the urban councils participating in the ADMARPs project have been supported to establish music, dance and drama groups which play an important role in mobilizing communities to seek HIV/AIDS services and create behavior change.
Dance helps to attract people and mobilize, and then drama and music passes the message to the community.
Amicaall also supported urban councils to reach the most at-risk populations through dialogues held in the areas where the MARPs operate, which are usually HIV hotspots. During these sessions, the MARPs are encouraged to open up about what they know about HIV/AIDS, as well as their challenges and fears.
They are eager to learn the new things, but what I've realized is that there are some assumptions we've been making across, thinking that HIV is known by everybody, the health workers, the community members, and even the politicians. One of the misconceptions is that HIV is not these days transmitted by sexual intercourse. They believe that HIV is transmitted from mother to child. They think that when you play sex, when you are drunk, you don't get HIV. That if you have a lot of vaginal fluid, those vaginal fluids can flush out the virus.
Under the ADMARPs project, hundreds among key populations receive sexuality and life skills training conducted by experts, including senior Ministry of Health officials and medical staff of the divisions.
Omuntu byoyinza okukozesa okwekuuma naki omuntu mwafuna siriimu omufuna mu ngeri etya n'enjigamu ekirala ki ekizibu ekiri mu kukozesa ekintu ekitamiiza ku mutwe.
Ngezezaako okuyiga wano nti okwekebeza mbadde sikyagala nnyo naye nfunye omutima ogwagala ekintu ng'ekyo ky'okwekebeza kiyambako nti weefaako mangu.
Kijjawo okwebuusabuusa mu bulamu bwo.
Enhanced HIV/AIDS service delivery, targeting mainly the most at-risk populations but benefiting the general community, is conducted in all 5 divisions of Kampala and Entebbe municipality.
So nga tulina okuba nga ffenna tuba lusi gye tutambulira tetumanyiiyo, so tujje twekebeze.
Bwe nkitegedde nti ndi mulamu kyawulina okwongera okwekuuma kusingako nga wembala.
Nawulidde mu kitundu kyaffe nti waliwo okukebera akawuka k'obulwadde bwa siriimu, nange nensalawo nzije bankebere era nfunye bulungi ebivudde mu musaayi nensangibwa nga ndi mulamu era nja kufuba okulaba nga neekuuma nga bwe mbadde wamu n'omwami wange.
Some of the outreaches are conducted among the fisher folk at the various landing sites in Kampala and Entebbe. Quick income from fishing makes most fisher folk open to reckless behavior, which increases the risk of HIV infection.
Naye nga bankeberako kko naye nensangibwa nga ndi mulamu, naye kyekyasinga okukola ki bwe nasangibwa nga ndi mulamu nange ne sikirizibwa okugamba konze kandekerawo okukola ki ebyobwenzi ebyo nembyesalako.
During the outreaches, safe male circumcision services are also provided to hundreds of clients who had earlier been sensitized by peer educators and local leaders.
After getting these knowledges, what I'm going to do is I'll just going to circumcise me to get it to reduce the risk of getting HIVs.
Family planning services are also provided during the outreaches. These include sensitization of mothers and distribution of family planning commodities. Some mothers who opt for implants receive them at the outreaches. Mothers also have an opportunity to access elimination of mother-to-child transmission of HIV services. The use of night outreaches in hotspot areas and strategic locations where many of the key populations can be found at night provide HIV/AIDS services to many of the target MARPs. These moonlight outreaches significantly increased the number of MARPs reached.
Me, I'm working a day, but at night they come and test it, and others are coming. This is a good, because those working a day, they can come and test from there as they are going out.
This element of moonlighting should be further emphasized because many people come in during the moonlighting to be sensitized about HIV and even to access facilities and services.
In a bid to reach more at-risk groups with HIV/AIDS services, Amicaall facilitated a knowledge room which was set up at a truck stop in Nakawa Division in Kampala City. Facilities in the knowledge room include indoor games and television entertainment, which provides an attraction to the clients who are then availed services such as sensitization, HIV counseling and testing, as well as condom distribution.
Before we got these games, we used to have like per week we could get like 100 people using the center. But with the support from Amicaall and these games that we have got, now our target we could be having more than 600.
Amicaall's support to the urban councils significantly strengthened their capacity to plan and respond more effectively to the HIV pandemic in their localities through the revitalization of their AIDS committees.
Really, the AIDS committee assists in making synergies of all the activities that are implemented by these other government partners and our health centers in fight against AIDS.
Under the ADMARPs project, Amicaall has partnered with the Ministry of Health Most At-Risk Population Initiative, MARPI, located at Mulago National Referral Hospital. MARPI provides specialized care for the most at-risk populations, including the most stigmatized and outlawed groups like commercial sex workers and men who have sex with men.
We offer a whole continuum of services as far as HIV and STIs is concerned. So we offer screening for sexually transmitted infections and of course treatment for STIs. We offer HIV counseling and testing for all these key populations. And of course we offer psychosocial support. We distribute condoms both at the facility here, but we also have condom distribution mechanism within the community through outlets, condom outlets, and of course through peers. We treat those that are positive or put actually on treatment for HIV here within this facility.
Abasawo batwalanga abaana baabwe babaganda baabwe bannyinaabwe tebatwenyinyala tebakugati waliwo oli akwesammula naye oli ne waaba amanyi nti nno oba oli ki yakutwala ng'oli mwana we oli sisita we oli okitegeera.
One of the things that have come up in our work with the most at-risk population is that they need friendly services, and the MAPI has provided that kind of environment, and we want to scale that up and bring on board other partners who can provide the same. So this referral development process is aiming at bringing on board these different partners who are providing HIV and AIDS services and fine-tuning their operation to be friendly to the MAPs.
As part of its community services, MAPI undertakes outreaches during which key populations are targeted for screening for sexually transmitted diseases, HIV counseling and testing, condom distribution, and referrals for care and treatment at the MAPI Center, Mulago. The Danish ambassador to Uganda, who visited the facility, was hopeful that the lessons learned from the facility can be rolled out to other health facilities.
The most at-risk groups we know is a group where the disease is likely to spread from even further, which is why we think it's important to target this group, and it's to make sure that this group also has access to health services and medical advice and guidance.
The intensified service delivery provided by Amicaall and MAPI under the ADMARPs project have generated increased demand for expansion and sustainability among these key populations, who are critical to all efforts geared towards reduction of new HIV infections to zero.
This should be the model to replicate across the country. I mean, if it can be very successful in Kampala, then it should work in all the towns. And as you know, the urban areas are holding the biggest proportion of the burden of the epidemic.
Going forward, Amicaall is now partnering with other organizations like Rotary to address broader issues of health and offer a more holistic package to include diseases like malaria, typhoid, and hepatitis.